On the 6th day of June 2016, the head teacher of Okibui Primary School in Usuku Sub-County, Katakwi District, wrote a letter to the district authorities indicating other strange disease had ravaged the health of some of his staff. Patrick Opolot spent months away from the school recuperating from the ailment. The head teacher's letter to the chief administrative officer was to address the teacher shortage. John Stephen Amodoi, the school deputy head teacher, revealed that hepatitis B was detected in 2013 when scores of pupils were diagnosed with the epidemic, and later last year when 8 others contracted the disease.
Those ones who are under the project of CHIS, because they came to diagnose them, they found that they were also positive. For them, they treated theirs because they were under the project.
There are fears that the disease could be widespread at this school.
We always see on and off pupils. They always fall sick or somehow what and so on.
Opolot is a science and maths teacher, but because he has been away, there are fears that the school will not do well in the PLE exams.
The learners are missing a lot because there is no teacher who has replaced him yet.
I spoke to Opolot, who is currently recovering from his home.
I had some pain at the left-hand side. So when I went to the hospital, they checked. They screened the blood for hepatitis B, whereby I was found positive.
He says that he has been economically constrained due to the medication he is receiving, and he is worried about the state of affairs at school.
Economically, it is the drug which is expensive, this Livolin. Because right now, you have to take 30 capsules of Livolin at a cost of 2,000 each. So right now, they recommended me, they prescribed me to take 1 per day.
Although hepatitis B is commonly spread through sexual intercourse, Opolot claims his wife is negative and could have contracted the disease through other causes. Opolot is amongst the few who can afford treatment in this backwater. John Orepi and his family from Kelim village in Ngariam sub-county are still mourning the death of his 16-year-old daughter, Josephine Akteng, who passed away last Sunday of hepatitis B. This picture when Akteng was only 4 is a grim reminder of a girl they hope to raise into a responsible woman. Gilbert Immaculate, a resident of Aojabule, cuts a forlorn and a dejected figure after losing his son John Ariko, a UPDF soldier. Betty Itengolet, who is the mother to Ariko, revealed that her son was the sole provider of the family.
Kunyara ingisi tutapele tai darekal. Kedi nandwe ikukyo kona cheke alabu ge wailanye. Dodongi sabu pele kai darachut.
Ariko was survived by 9 children, of whom 4 and his widow are also hepatitis B positive. Ariko's sister Josephine Ikulet and brother Simon Peter Odukatum, who used to nurse him, also contracted the disease. Ikuret says that she has never received treatment because the family lacks funds and fears she could die. Out of the 15 members in the family, only 6 were screened and 5 found positive, as fears are abound about the health of the others. Some of the patients that we visited, like Aloysius Ongaria, were meek and unable to speak. At Katakwi Hospital, doctors say that the number of people screened with the disease is increasing.
We've had quite a number of our patients die secondary to the complications of hepatitis B.
Dr. Emmanuel Oluka, the medical superintendent, blames the situation on little sensitization, whereby many come to hospital in the last stage of hepatitis B.
Most of them come when the liver is completely damaged. They come when liver cirrhosis has already taken place. We've also received occasionally patients who come with already hepatocellular carcinoma. And at that time, there's nothing much we can do.
He also acknowledges that the hospital lacks hepatitis B vaccination, symptomatic of the ailing state of the healthcare system. Patients who are treated in health facilities far from Katakwi Hospital never get the basic medication as a result of lack of drugs and screening materials. Joyce Atim is the nursing officer at Akum Health Center too. She believes that there are many hepatitis B patients, but she lacks equipment to test for it.
So I don't have those facilities so that I can test, but most of the time I capture them when they come for treatment.
Patients who come to Akum Health Center too do not get much help because the clinic officer here says she lacks the basic equipment to screen for the disease. Now, many have to go to private clinics or incur transport to Katakwi Hospital, and because of the biting poverty in the land, many claim can't raise this money. As the disease sweeps across large swaths of Katakwi, there are calls for government to hastily intervene.
I don't know if government can help and bring that program of immunization, because what is happening now is they only immunize if they find that family is affected.
Katakwi district, which is tucked away in northeastern Uganda, faces the threat of famine, we shall explore in this continuing series. Solomon Kawesa,